Hello, everyone. My name is Dr. Fiori. Welcome again to my channel, Body and Mind Unplugged. This is a safe space where we break down everything medical, mental, in between, in a very simple and relatable way, devoid of medical jargons, so we can all relate. So, you're welcome. Last week, I did talk about high blood pressure, the risk factors, and the consequences of it not properly managed. Today, I want us to dive into another serious medical problem known as prediabetes. What is prediabetes? Prediabetes is more than sugar. It means that your blood sugar level is higher than normal, but then again, it's not quite high enough to diagnose you with diabetes. So it's your body's warning system. Now, you may want to ask me, why should I care? Well, remember when I did say that high blood pressure is a silent killer because it usually doesn't present with symptoms. The same with prediabetes. It also doesn't usually present with symptoms. So I like to call it silent threat to your health. If you have prediabetes that is not properly managed, it can lead to full-blown diabetes, heart disease, stroke, kidney issues, or even nerve damage. Now that you look at it that way, it sounds quite scary, right? So, how do you know that you have pre-diabetes? Usually, pre-diabetes is not diagnosed routinely in healthy adults. But if you have risk factors, which I'm going to be talking to you about in a minute, then your healthcare provider can test you for prediabetes. Usually, there are 3 tests that can be run. The first one is your blood sugar, your glucose level, your fasting blood sugar level will be tested. And if your levels ranges between 100 and 125, then you fall within that category. Another test is called A1C test. This test check the average of your blood sugar levels, not just for that day. So I like to call A1C your blood sugar report card because of that reason, because it checks your blood sugar level within a span of time, usually between 2 to 3 months. Okay. Another test is glucose tolerance test. When this test is conducted after sugar intake and your levels are high, then you can be deemed as somebody who has prediabetes or even diabetes. So now that we know what it is, why you should care, and how it can be tested for, what are the risk factors? When you're obese, when you have a family history of diabetes, when you are somebody who is age 35 and up, when you're a woman who has given birth and you were diagnosed with gestational diabetes, then you also fall in that category of people who are high risk of developing prediabetes. Unfortunately, years after you've given birth, you still have the high risk of developing that just because you have previously been diagnosed with prediabetes, okay, or gestational diabetes. Another group of people that are also prone to developing prediabetes are people who are African American descent, Asian descent, Hispanics, or American Indians descent. So if you're somebody that falls within that category, just know that you also have high risks of developing pre-diabetes. Okay. The big question now is pre-diabetes reversible? Of course, it's reversible. You can easily reverse pre-diabetes. If you know that you have it, Then you can do some lifestyle changes like lose weight if you're obese, okay? Move your body more, eat smart, work on stress because our stress hormones can increase our blood sugar level. Sleep, quality sleep, because if you have poor sleep pattern, you are also prone to having insulin resistance. So you see, it's very imperative that you pay attention to these things so you can reverse your prediabetes. Look at it this way. You're driving down the road going somewhere. You have 20 miles to your destination. But your gas tank is giving you a warning that you're going to be empty in 15 miles. What do? Do you exit the next gas station and fill your tank up, or you just keep going and hoping that you get to your destination with no problem? What if you get stuck on the way in the middle of nowhere where there is no gas station with a vehicle that's not moving? It's going to be more challenging for you to reverse than heeding to the warning signs. That's the same way. Prediabetes is a warning sign to reverse. So yes, it can be reversed. Okay? Always take charge of your life before you take charge of you. Be intentional and excited about healthy living. If you're new to this channel, click and subscribe, share, and let's keep having this conversation. I'll see you next time.